6 o'clock, and welcome to the latest edition of the Diabetes Chai Chat. This is actually our first of the year because Silver Star has been traveling all over the world, spreading the message about diabetes awareness. As you know, we've been to Kerala to hold a camp there. We've been down to London to Harrow, where we launched the annual diabetes walk. And we're back, at least I'm back today in Leicester. And we're joined today by our guest speaker who's joining us from Barts Hospital in London. I will introduce him in a second, but the topic for today, for the next 30 minutes, is diabetes and heart surgery. Before we get into that, let me just report back. We had a very successful last camp in Kerala, where over 250 people were tested for diabetes at a major city in the commercial capital of Kerala called Thrissur, where we were joined by, in partnership with the Mother Hospital, and they provided a lot of the infrastructure that we needed to test a lot of people. We then did a diabetes healthy walk with a school in Goa. Over 100 pupils took part in that to try and keep up our campaign of getting schools to be healthy and provide healthy eating. But our topic today is diabetes and heart surgery. And our guest speaker is Professor Shamsundar Kolvikar, who is a globally renowned consultant cardiothoracic surgeon based at St Bartholomew's Hospital in central London. It's actually the oldest hospital in England. Of course, its facilities are very modern indeed. He specialises in coronary artery bypass grafting, valve repair, and aortic valve replacement, as well as treatments of chest and deformities and lung cancer. He's an internationally renowned expert in adult NUSS and pectus up procedures. He's a leader in treating various conditions of that kind. His innovative techniques focus on improving pain management and minimizing surgical risks, leading to better patient outcome. So, as is usual with Chai Chat, we have gone live. So, although those who are watching on YouTube can't participate by asking questions, those who are actually on the Zoom call will be able to ask questions at the end of this session. And if you wish to do so, either send an email to Rajiv in Leicester or put your little yellow hand up when it comes to the Zoom call. So welcome, Professor Kolvikar. You must be very, very busy. We're delighted to have you on. We've not looked at the issue of cardiovascular issues and diabetes for many months now, and what you have to say is very relevant. So you're on for about 15 minutes, then we're going to have 15 minutes of questions. Thank you for joining us from Barts Hospital. The floor is yours.
Thank you, Keith. Thank you for inviting me to speak to Silver Star. It's amazing work you're doing because diabetes should be taken very seriously. Just about a Bath hospital. Bath is actually 900 years old. We are not 900, but I think we treated ourselves and we stayed alive. But it's quite modern hospital. Government spent around 2 billion to make it what it is now. So it's one of the leading cardiovascular unit in the Europe. With that, thank you again. And I think when you asked me about diabetes in the heart, I thought this is a very important topic because in UK, around 7% of a population does suffer from diabetes. Diabetes, it's a type 2, which is adult onset. There is another diabetes which has a different treatment, different outcome, and we won't discuss that one. And funny enough, it's very prevalent in South Asian population. Almost 20% of Indian, Pakistanis, Bangladeshis suffer from it at one of their lifetime. And it affects them quite a lot. And if untreated, around almost 1 in 3 of these patients will require one way or something as a cardiac surgery. So with that introduction, I'm very serious that people who are diabetic has to take it much more seriously. As we on this planet, we take oxygen to stay alive. It's the same way if you don't treat your diabetes, it will affect you one way or other. You can start from head, go down up to toes, and a worst case scenario, if you have to legs or toes are chopped off, it's not very pretty sight, and it's quite painful. So with that introduction, I'll tell you how it affects. See, diabetes, we have in a body, there's a certain hormone secreted called insulin, which is secreted through a small gland called pancreas, and it has got a finite uh, production, and there are finite cells there. If look this way, if you got a sort of a 60 kilo person, and you got that much insulin, it will treat it okay. You will be fine. You won't be diabetic. But suddenly you become 120 kilo. The insulin is not enough. So your sugar will not be metabolized. And if it's not metabolized or it is not utilized, your sugar will increase. Increasing sugar in your blood can affect several ways. One of them is affects your heart, your body, intestine, brain, eyes, your nerves and arteries. It's one of the commonest thing I see. I do cardiac surgery. We do almost 2,000 cardiac surgeries in St. Bartholomew's, and out of which around 60% is a bypass operation. And almost 1 in 3 patients have a diabetes at stage of their life. And the best part of type 2 diabetes, you can almost reverse it. If you're stringent in the beginning, if you reduce your weight to every 10 kilo you lose, you will see your requirement of medications will go down tremendously. I think I'm not saying you go for this gastric bypass or other things. There are lots of help available. Government is very serious. If your body mass index is about 30, your GP can prescribe you some of these medications which can take away your appetite. But it's very important that you have to make a determination to you. Today I saw one patient. This man had already they chopped his toes and it's not healing. He got infection in toe. He's on a dialysis and he needs a bypass operation only. Bypass is where you connect new tube to create a blood supply to your heart because they're narrowed and they can get heart attack imminent anytime they can get a heart attack. And this is the reason we need to do that. And this patient is very high risk because I had to deal with his bypass, but he also have a toe issues that can get infected. His kidney needs a dialysis. So it's lose every situation. And when I saw him, this gentleman was having chocolates. And it was difficult. I just have to be wary of it and give a stern advice. But how much I can do, it has to come from your side. So to stress the point, because we are somewhat South Asian, we genetically we get this hereditary from our parents. If you have a parent's diabetes in the past, your chance of getting is almost 50-50. And if that happens, you got to aware of it. Anybody above 40, you must get a test. There's a simple test, you do blood test that can tell you that you have a diabetes or developing diabetes. And that's your warning shot. What you do afterwards is a different thing, but you must be aware that this is going to happen. Can you imagine there are 40% of Asian population in this country are not aware that they got diabetes? They only find out when the complication happen. Sometimes your sight goes because of retinal detachment. You get heart attack. You get uh, pain in your legs, and you think it's arthritis. It's not, and your toes fall off. So these are things can happen. And the worst is called diabetic neuropathy. That means the diabetes affects the nerves of your legs and body, and then you suddenly lose sensation. So you can't feel your feet, you can't wear shoes, and it can give you really shooting pain. And that's a very miserable thing to go through. So strictly, I personally feel you have to take these diabetes very seriously. There are treatment. Simplest treatments are first with a diet. If you control your diet, you don't need to organize on yourself. There are a lot of self-help group. Ask if there is a chart thing with a silver star. They can help you and put you through. If your GP is astute, then he can get you with a nutritionist and they can suggest you. You could be vegan, vegetarian, or you could be meat eater. There are several ways of you can manage this with a diet because diet is first line of things. Along with the diet, you should have a regular activity, at least around uh, 20 minutes a day, or if not around sort of uh, a half an hour every other day. If you do it, that's a good activity. Not walking for a smoke, but actually doing a brisk walking. If you're going to work, just climb up the stairs or at least get down the stairs. That's an exercise for you. And think about weight reduction. If you check your weight and if you think you are overweight, then you are overweight. You don't need to wait for people to tell you, oh, you look slim. See, all mothers think their children, even if they are really large BMI, will think that yeah, they are still slim. But important thing is these are the things you must keep in head. Get your medic checkup, then you get medic diet, and then you work on getting your weight down. If you do simple thing in the beginning, you may not have a problem. But suppose you have a diabetes, there are lots of treatment for it. There are first tablets, which works very well. They will utilize your insulin better way. Then there are injection of insulin. The last resort is those injections which controls your sugar and also weight. They are effective in a group of patients who cannot control the weight, but they have a side effect because it takes away your appetite. That means you don't eat. It will work for you, but important thing is when you stop, they are costly. Then it may come back to you. You need a determination for it. Besides all that scary talk, what I do is I most of my patients who are diabetic require a bypass operation. Then we there are several options. You can have a stents, or we can they do it through your artery or your leg, and they can open up these narrowed arteries. But there are other treatment where if they can't fix it for diabetes, especially we have to do bypass operation, where we split open the sternum, small incision, and then we connect new tubes, one from your chest wall called mammary artery, or there are tubes from a leg. We do it to the keyhole, and we use it around 2 to 3 of these, and they bypass any obstruction in your arteries. This is like you got a roadblock and you create a diversion. That's how we create a blood supply to your heart. And that makes it safe. It could last you for 10, 15 years. If you had a stents or angioplasty, they can last also for a long time, but usually they usually last for 5 years or something, and then may require some intervention after that. These are the one step of diabetes and heart disease. The second part is if you're diabetic and have a surgery, your healing is a problem because the diabetes work affects your blood vessels. So when we split open sternum, sometimes it doesn't heal, so it may not unite. Sometimes it get infection. Your chances of developing infections are extremely high. And if that happen, your sternum could fall apart. Then you means you have to stay in a hospital for weeks and weeks till we fix it. And sometimes it takes long to heal it. It could be very painful. So that's a problem with diabetes and healing. And diabetics people have chance of infection because can you imagine if you have a high sugar, any bacteria goes into your bloodstream, they will have a party time. They say, my God, I have such a sugar boost, I'll stay here. And they can cause you infection to your blood, they can cause infection to your wound, they can cause infection in your lung, and they can make you really, really ill. And that's very important. And besides other operations I do is like a heart valve changes, we can do replacement. And even that, if you have a diabetics, it affects your healing, affects infection rate, and also complications. And a lot of diabetic patients who were their diabetes for some time and recently diagnosed, their kidney are also struggling. And when we do heart operations, sometimes your kidney can be stunned. So you may require some dialysis like treatment for certain time. And after that, probably sometimes you may require dialysis for permanent time. So diabetes affects almost every organ from brain to toe. It's very important. And especially as a cardiac surgeon, it increases our work in a way. I'm not complaining for that, but I think I want you to know that it's very serious. And especially for South Asian community, it's almost 20% of us will suffer from a diabetes. And it's all related to those prasad you eat, those laddus and mithais and ghee and things. So I went to all the Swaminarayan temple and told them they're displaying our 108 ways of sweets. I said, that's fine. You should just display them and give people fruits. It's much healthier than giving them those sweets. I'm not sweet is bad or something. Everything in your life is moderation, works well for you. But if you go on binging on it, and funny thing is, I had one of my patients, his son makes these sweets. They look like sweet, they taste like sweet, but there is no sugar. And you should adopt that. I think Boots sells some, but there are different varieties. If you can't live without a sweet, try on that. Carbohydrate in moderation is good. Extreme can lose this problem. So I think overall, if I'm not scared you off, but it's important that we should aware of these. We do very small amount of patients. I don't see all of them, it, but the people who come to me, it's almost extreme case because they have diabetes for some time. It's affected, flood their arteries and come for a bypass operation. And that's the reason I thought I'll tell you that. And I think with that introduction and a brief review of that, I think I will ask the Keith, anybody else want to learn more about it, I can explain. But I personally feel it's enough scaring you off about a diabetes and heart. And I just want
Wonderful. Thank you.
you guys to come with your questions. It's not easy to live with it, but my advice to you, every kilo you lose, you will put the pharmacy company into bankruptcy because they're making money on it. We are lucky we got NHS. In America, people are buying insulin on black market. Shame on them. It's one of the most civilized, richest country, and people have to come here to buy. A lot of Americans come to India, take packs of insulin because they keep increasing price of it, and that's really shameful. Thank you.
Thank you very much, Professor Kolvika. That is a good warning to all of us as to what we should eat. You go back to that central theme of diabetes, which is lifestyle. What you eat not only affects your diabetes, but also your heart. You've set out very clearly that there is a connection between diabetes and cardiovascular issues. But what is the tipping point? Some of us have had diabetes. I've now had diabetes for 15 years. When do I know, apart from symptoms, when do I know that there is going to be a problem with my heart because of diabetes? When do we know this? What is the tipping point? Is it, do we wait for symptoms, or is this something that our GP should recommend that we look at because we are diabetic?
I think usually your GP, if they are good practices, will send you this warning sign. When you go at 40, they do check for your blood pressure and they take blood and see if you've got diabetes. Because even when you come to, people do this trick to insurance. They go fasting. When they take a little blood, your sugars are normal. But if you go on the HbA, which tells you what your sugar varied in your blood for almost a week before, and they will know that it's gone up or high. Percentile tells you whether you're diabetic or not. Our simple test, all of us we can do. You don't need to do blood. You get those dipstick. We should call it a dipstick. You get these little things. You put it in your urine. It will tell you. But if urine tells you you're diabetes, that means you already have got a really, really high sugar in your blood because it comes in the urine. So that's a thing you can do. But the most important thing is your GP will tell you these tests done. So if GP sends you invite, please honor it because it's for your own good. And if he's not doing it, you must tell him. If your parents are diabetic, and if you know there are some people you should. The easiest sign is if you're feeling thirsty, and you're going to toilet even though you don't have prostatic issues going all the time, and you feel that you've got a central obesity and your legs are slim, it's a sign of undiagnosed diabetes. So being paranoid thinking you're diabetes is far better than ignoring it altogether. So as Keith, you asked, you can go to your GP, he will sort you out. And best thing is if you have those sticks, you get it from Boost, you can test it yourself. But if your parents have diabetes, there is a 50% chance you may develop it. You may not.
Mm.
Healthy style, you may totally prevent it. You reduce your weight, your diabetes will disappear. This is the most important thing. You drop your 10 kilos, you will say bye-bye to your medications.
Super. We saw in the chat that Thelma from Northern Ireland advised us that they have a diabetes prevention program there, but we're supposed to have it also in England. I've just written to the new CEO of the ICB, which is the Integrated Care organization. They keep reorganizing. Every government reorganizes it, so that's what it's now called. To ask what the program is. Professor is smiling, he knows exactly what I mean. But let's go to a question. Can Kunasinam has a question, his hand is up. So
Yes.
unmute yourself and ask Professor Kolvaker your question, please.
Thank you very much. A couple of quick questions. I'm diabetic for more than 10 or 15 years. Take medication from GP anyway. But I just want to ask, they prescribe Orlistat to reduce my weight. Is it okay to take these capsules? That one question. The other one, some Indian shops nowadays, they do using the sweetener, do things, rather than the sugar. Is it okay to have them? These are the two questions.
Sure. The first question,
Orlistat, it's
the
actually
GP started you something, that's good. You should keep doing it because, and measure your weight. Most important deterrent is that you should weigh yourself almost every day. It
okay.
incentivizes you. Even if you lose 1 kilo today, best time to do it just before you go to shower. If you weigh, it usually shows you a bit lower weight than do it in the evening. It just encourages you to. And then it's like a competition, like when you are in a school, your mom says you got 10 marks and the bunty from other house got 12, then you'll work hard to get 12. It's the same way. If you think I was 90 yesterday and today I'm 88, hurrah. So pat yourself and do that. That's important. And that tablet they prescribe GP is fantastic. The the sweeteners have its own complications, but if you can't live without a sweet, then that's an option for you. See, like people who go on those fizzy drinks, I think the Coke Zero diet thing, these are good replacement, but I think it's far better not to have them. But if you can't live with it, then you do, because you remember, I shouldn't be saying these big colored juice, colored water companies actually put something in that. I have no proof to it. Maybe allegedly they put something in that which makes you hooked up to it. And that's why people who take those fizzy drinks, they're craving for it. But if you get those sweeteners from India, that's fine. There are lots of sweets. There are if you go to Boots, I think go to the reputable place. They will advise you on it. And there are sweets which look like sweet, looks like chocolate, but we know because we have dogs and they like chocolate, but it's harmful for them because they hardly have a pancreas. So for them, they create a chocolate look-alike, which taste, but they're vegetables. So that's how the sweeteners are. But if you can't live without a sweet, please go for a sweetener.
Yeah, if you can go to Boots, that's okay. Yeah, is that what you're saying?
I think Boot is very reputable company. Banting Boots, that's the company first sold you the insulin. Insulin was invented into liver some time ago, and it's actually British invention.
Yeah. It's okay. Thank you very much indeed. Thank you. Thanks. Thank you.
Nasreen, do you have a question for us?
Yeah.
Yes,
Sorry.
yes. Thank you.
Nasreen, yeah.
Sorry, I was trying to put my hand up, but wasn't coming up.
That's
Thank
okay.
you very much. That was really, really good. And what I wanted to ask was that because, you listen on the YouTube and all that, it says that the vegetarian diet helps sort of, vegetables and fruits and things like this than the meat eaters. And of course, we are big meat eaters. So do you agree with that?
No, I think it's just it is like this. People see YouTube, you will find all the answers. There is even a flat Earth society on it. They claim that they have a map that Earth is flat. So YouTube has a fantastic thing where whatever you believe, you find some person who believes same as you, and you can carry on saying kumbaya. But that's not right. Important thing is every diet can be okay. Funny enough, the meat eaters probably have less likely to develop diabetes. But what you eat with the meat is a problem. Like Nasrin, if you have a lot of rice with it, if you have lots of rotis with it, or lots of potato with it, then that makes it worse. But lean meat by itself is much safer. Vegetarian diet has most of its carb. So now they're replacing with pulses and things like that. That's good. But rice and bread, everything in moderation in life is good. But moderation, we don't know what our moderation is. Think this way, if you eat in a big plate your food, tomorrow you eat it in your tea plate. And if you can eat from that, that will be the moderation for you. So, no, if you're a meat eater, carry on, whichever way you want to eat it. But the supplements you put on, that lovely pulao rice and biryani, just if you shrink that one and potatoes, instead of have a lot of vegetables, broccoli, green stuff, it's good for you.
Right, right. Thank you.
Wonderful. Any more questions to Professor Kolvaker? Before you close, and we're nearly up to our 6:30 mark, could I ask you, Professor Kolvaker, today, I was very naughty because I crossed Uppingham Road. There is a new restaurant that's open. And even though I'm a diabetic, I made sure that I was in the box. I was under 9. I had a milkshake, which was very bad for me. But I had it anyway because I was dying for a milkshake. And I found that the milkshake was stuck kind of just in the beginning of my esophagus. I could feel it. I can still feel it now. Does this tell me something about my digestive system? Is the digestive system linked to, because some people might think they're having a minor heart attack, but actually it's indigestion. Diabetes, indigestion, cardiovascular, is it linked, or is indigestion something that is quite separate for people like me?
Fantastic question. Diabetes is all totally linked to your gut emptying. It affects your nerves. It also affects the sympathetic system. For a gut to move, you need sympathetic and a parasympathetic. These are the nerves which we don't control. It controls your gut movement, and it gets sluggish, emptying stomach and intestinal empty time. If that happens regularly, see your GP, or you may require some medications. Like, please, whatever I tell you here, get it confirmed from your GP. Okay, this is just advice. So they use this tablet called metoclopramide, which is extremely good for your gastric emptying, and that may be the case with you. Majority of diabetic who are on a diabetic treatment will go through this sluggish intestine. Your stomach is full, it's not emptying, you get bloated, and you sit there, you have to walk and things like that. This is a sign of diabetes affecting your intestinal nerves and emptying. So for that, there is a medications, and it's simple. You take it with every meal for few days and few weeks, it will all go away. It's called metoclopramide. And if you go to GP, he will instantly start you. Everything what you do for diabetes, please keep your GP in loop. They're very good doctors. Only thing is they are so inundated with work. If you go and develop a rapport, they will help you. I think coming from NHS, if you annoy us, we will listen to you more.
Well, that's great, but you need to get an appointment to see your GP. That's the problem.
We have
the
put
problem
a
we're
wall
facing.
there for a reason, but you can always find out email. Okay.
We try. We will take your advice and we will quote your name the next time we get an appointment. Professor Kolvaker, thank you so much for joining us on the Chai Chat today. You're welcome to stay. We've just got the diabetes headlines that are coming up in a second. But we want to thank you for all the work that you've done educationally in India and in the UK, at Barts and in other hospitals, in order to draw attention to the importance of cardiovascular issues. I'm going to ask you one final question, because Valentine's Day is next 2 weeks' time. and there's going to be a lot of talk about hearts, of course, different kind of hearts. But can you tell me one thing that we should eat? One thing, apart from drinking water, we know we have to drink a lot of water. One thing that's going to help our hearts.
I think one thing helps your heart is apples, green vegetables. If you eat those, they're fantastic because greens has no carb, they're proteins, and they will keep you going. Have you seen a Popeye the Sailor Man having his vegetables? Yeah.
We have spinach.
Remember spinach. Remember Popeye? Why he's so healthy? Because of spinach. It gives him energy. If that doesn't entice you, what else?
You're right, because Popeye must now be 150 years old.
Oh, yes. I think
Since
when
he
when I
originally-
was a child, he was still young. So you can imagine.
So he's done very well. Thank you so much for joining us. You're welcome to stay, but we will no doubt see you again. Thank you so much.
Thank you very much, everyone. Thank you.
Thank
Stay
you.
safe, stay healthy,
you.
low carb.
Thank you so much. Thank you, Professor. Let's go back to Leicester. I think we have our headlines of the week. Thank you, Professor Kolviker, for your speech. Headlines of the week, 3 top headlines. Rajiv, what are the headlines of the week?
Headlines of the week. Warning signs on your face and skin can which be caused by diabetes. The skin depends on blood circulation to deliver oxygen and nutrients to skin cells. When this process is disrupted due to complication with diabetes, issues begin to surface. Some people might notice that their skin is becoming dry and itchy, accompanied by noticeable redness. This discoloration can appear more severe with dark patches, rashes, blisters, and sores. Skin tags can also start to appear on the faces of individuals with diabetes, although they are not always a sure sign of the condition. Next headline, global study estimates vitamin D as most common deficiency in diabetes, magnesium coming the second most. New study finds that levels of vitamins and minerals essential for healthy bodily function are far too low in people with type 2 diabetes. Women with diabetes were found to be at higher risk of micronutrient deficiency, also termed hidden hunger, compared to men. The next headline, kidney bean for sugar level control and heart health. The kidney bean have low glycemic index, which means it can cause a slow and steady rise in blood sugar levels. Kidney beans are also suitable for people with type 2 diabetes. It contains potassium and magnesium, which support cardiovascular health. It can also reduce blood pressure due to their high potassium content. Thank you.
Thank you very much. Thank you, Rajiv, for the news headlines. And welcome to all of you. I'm glad we're back on the air, Diabetes Chai Chat. We will get another speaker lined up for you, I think, from the Diabetes Centre in Goa. He'll be joining us in the next week or the week after, but we'll let you know. If you have any friends who are pre-diabetes or have got diabetes, please get them to join the Chai Chat. I was having my breakfast at the cafe up on Uppingham Road today, and a gentleman who lives in Tennis Court Drive said to me, my wife is pre-diabetic, what should I do? And I said, listen to the Diabetes Chai Chat. From the week after next, we are starting testing for diabetes every Wednesday at the headquarters. You can drop in, as you previously did at the Merlin Vaz Centre. It's going to be 201 Uppingham Road. You can't miss the premises. It's covered with Silver Star posters. So we will see you then. We then have a diabetes, the van will be going out to Asfordby Street in the next 2 weeks. And from there, we're going to go to Essex, where we are going to go to the headquarters of Neon Diagnostics. So for today, we've kept to our timetable. It's 6:35. For those of you who are joining us on YouTube, thank you very much. For those of you who've joined the Zoom, again, thank you. And we will see you again very soon. Good evening, everybody.